I gotta say, it's a bit refreshing to talk to someone who's actually looking at healthcare instead of tech. I mean, not to say that tech's not exciting, but
sure.
the demographics of China really support your investment thesis.
Right, exactly. If you look at the Chinese demographic trends, both today and going into the future, it is very clear it is a very rapidly aging society. So we're actually adding about 1 million senior citizens as defined by people over 60 every month. This is net addition. So that basically means in 5 or 6 years, China will have more people over age 60 than the entire population of the United States. That's an astounding number. Right. And those people have different needs. And there are many products and services today that don't yet exist or are not there in the same way as they should be to cater to those demand. That's kind of the opportunity we see at Long Hill Capital. That's what we focus on.
Right. So you guys have been around for 2 years. You've raised $260 million US. You've deployed how much of that already?
Well, we actually raised our first fund, $125 million, which is 2 years ago. And then earlier this year, about three months ago, we completed fundraising for our second fund, which is $265 million. And of that fund, we have deployed less than 10% at this point, although with Fund 1, we now have over 30 portfolio companies.
Is it as crowded in healthcare as it is in, say, TMT, for example? Because a lot of people talk about TMT, but it does seem like healthcare also has a compelling reason to be in there. Your thoughts on just the crowdedness there?
Well, from our vantage point, it is not as crowded. There are many more TMT-focused firms than healthcare-focused firms. And in particular, to us, we're not a life sciences firm. So we focus on the services side of healthcare, both online and offline, right? And so when we look at the opportunity set and look at the competition and look at how many people are doing it, we feel like we're sufficiently differentiated. That's why, if you look at our companies, the kind of valuation we're able to get is very different from...
So you're getting better terms?
Yes.
You have 30 portfolio companies.
Yes.
Tell us something cool. Like what do these companies do that people don't normally associate with healthcare? Like what's cutting edge at the moment? What's needed?
Sure. I'll give you one offline example and one online example, right? An offline example is a company called GST Clinic, which is today China's largest traditional Chinese medicine clinic. Now, this is a company that got started 4 years ago, and we got involved in their Series A as the only Series A investor, where we only put in $2 or $3 million. At the time, it was a couple of million in revenues, right? This year is going to do over 150 million in revenues and significantly profitable. And the number of clinics have gone from 2 or 3 clinics to close to 50 today.
Okay.
Right. So that kind of growth you don't usually associate with a clinic operator.
Bricks and mortar TCM.
Yes. But it is possible because with new technology, with new business model innovations, you're able to generate the kind of growth that wasn't possible before. There's another company called LinkDoc in our portfolio, which is China's largest and most prominent medical AI company. And what they focus on is oncology. So they have, by working with large hospitals, they have accumulated, patient data on over 3 million cancer patients. And they're using that data to transform not only medical research, but also the practice of cancer care and treatment for millions of Chinese patients. And that company has gone from a raw startup 3 years ago to today a unicorn. Right, the last round was led by CIC. And so those are 2 examples of very different companies, but both exhibiting very high growth because of the opportunity.
Yeah, and to that point, I know you're going to tell me there's no bubble in valuations in healthcare, or is there? Because you're invested there, so I'm not sure how you would spin that.
I wouldn't say there is totally no bubble, especially if you were talking about the last 3 years. I think selectively there have been some bubbles. There have been relatively fewer of them compared to the TMT sector, but everything is being rationalized now because we're in a different environment in terms of both fundraising for private equity on venture capital and also financing environment for start. So I think things will work its way out, and things will take care of itself in the next 6 to 12 months.
Right. As a final question to you, there doesn't seem to be any obvious risks to investing in healthcare in China, because everything seems to point to in 10, 20 years' time, it's going to be a bigger industry than it is today, and lots of things are needed. What are the underappreciated risks, in your view, to the growth of the healthcare sector that you think about, that keep you up at night?
It doesn't necessarily keep me up at night, but on the other hand, I think one of the most important things is, healthcare obviously is a regulated sector.
Okay.
So the government has been very supportive of this very important transformation in healthcare toward more private capital-driven. And President Xi actually at the Shanghai Expo a few days ago specifically mentioned that, right, encouraging more foreign capital to go into the sector. And we would like to see that trend to continue, which we believe will. But that's certainly some very important consideration that we have. But we are very optimistic about this continuing.